Hi, I'm Murtadha Hssayeni. I'm a research assistant and a PhD candidate in computer engineering at Florida Atlantic University. This work was done as part of the project um, modeling corona spread using big data analytics that's funded by NSF Rapid grant in a collaboration between FAU and LexisNexis. And we started the work during the fall to 2020. So the part of the project that I'm presenting today is the forecast of COVID-19 spread risk at the county level. Okay. So the agenda of this work going to be, let's start with the introduction, related work, contributions of this project, the data set, methods, results and discussions, and then last but not least, the conclusion and future work. So the first thing is with the opening of the world economy, one of the critical issues about the coronavirus virus disease 2019 is the delay in the outbreak detection. This delay may leave the healthcare facilities unprepared. The early detection of COVID-19 outbreak, thus it's important to save people lives and then also save the economy. Usually there are two general epidemiological approaches to model the spread of the virus, which are mechanistics and forecasting models. The first drawback with the constraint with the mechanistics model is that they are known to be effective for long-term predictions, but less effective for predicting the resurgence or the outbreak of the virus. On the second thing is that social behavior reflected in their mobility data play a major role in spreading the disease. However, traditional mechanistics model do not consider social behavior, which is essential to forecast COVID-19 risk prediction. There is a large body of research toward forecasting COVID-19 cases and deaths. So the research toward COVID-19 forecasting using the mobility data has been limited to the country, state, or the metropolitan area level. So it's not been highly focused on the county level prediction. So the use of mobility data has been done in a couple of research, but as you said, not at the county level. So Chang et al. Integrated the mobility data with an SEIR model to forecast COVID-19 spread in 10 largest metropolitan cities in the US. Another work, Alita et al. Also integrated mobility data from mobile devices and demographic data with a mechanistic model to forecast COVID-19 spread in Boston metropolitan area. So to coordinate the forecasting of mortality and incident cases, also the CDC initiated the COVID-19 forecast hub in April 2020. Several modeling teams have contributed to the hub for forecasting the mortality and incident cases at the national and state levels. And then this model has been evaluated also on these two levels. However, at the county level, we didn't find any evaluation to these models. So that's for the contribution of this work is the integration of the mobility data beside COVID-19 statistics and county level demographics to train a data-driven deep learning model to forecast the short-term spread of COVID-19 at the county level. And also we performed detailed analysis to study the effect of government responses on COVID-19 cases and the model's ability to reflect the effect. And on the other side, also we studied the effect of age demographics on COVID-19 spread both using our model and then also the actual cases. So the data set that's been used for this work consists of static and dynamic data at the county level. The static data consists of the population density, a household population ratio, car density, percentage of young adults, and also retirees. So this data was initially retrieved from US Census and the LexisNexis profile booster data source. And the other part of the data was the dynamic data that consists of the mobility data representing the social behavior and COVID-19 statistics. That includes the daily positive cases, deaths, and recovered cases, and also the immunity factor. So the daily COVID statistics all are retrieved from Johns Hopkins University website. So the mobility data on the also, which is part of the dynamic data in our case, was represent the volume of trips people requested using the Apple Maps app, and was provided by Apple. So this project used the HPCC system platform for collecting, hosting, and also analyzing the data. For more details, you can visit covid19.hpccsystems.com to see the data, especially used for analyzing and also visualizing the COVID-19 cases and deaths. For this study, we tried the dynamic data from February 15, 2020, when the COVID-19 started, to until January 22, 2021, when we performed the analysis in this work. So the method. We build a deep learning model based on long short-term memory to forecast the accumulated cases of COVID-19 case in the next 2 weeks. So the input to the model, as you said, is the static data and the dynamic data at the county level. For example, here we are showing like for Miami-Dade. And then the output from the model is going to be the accumulated cases in the next 2 weeks. Here we are showing one example. For example, the blue is the actual cases, and the green is the estimated by the model. So LSTM that's been used as the deep model on this in our work is a particular type of recurrent neural network that has been shown to effectively learn the temporal dependencies of time series data in many applications. So we trained our model to learn how the past and current number of cases and also people mobility data will impact the future cases, and in our case, the next 2 weeks. So for the method, as you said, like more details about the method. So the accumulated cases in the next 2 weeks represented by YT plus 14, right at the county C, is calculated by first feeding in the data point from day T minus T capital to the day T, which is the current day, to one LSTM network. So we feed in the data, dynamic and static data, to fully connected network to map in the depth of the let's say the time series to the depth of the we're representing the number of hidden states within the LSTM network. And then these equations represent the different gates within the LSTM model. So we take the input that's mapped to the same dimension of the hidden states, and we feed in using a specific architecture for all these different gates. And then the second step is using the hidden states from the network. LSTM network is passed through a fully connected network also, right, to forecast the cases in the next 2 weeks, which is the represented by YT plus 14. So the other thing about the model is that we fine-tune the model weekly when more data points and the corresponding labels are available. So let's say for this week, we got in the data from the previous 2 weeks, so that we use that data to train the fine-tune the model again to predict the data for the next 2 weeks, and so on. We performed a grid search is applied to find the best number of layers and also the best number of hidden nodes based on a validation data that we are selected randomly from the training. For comparison reasons, we implemented a gradient tree boosting model, which is a well-known model in machine learning for also for COVID-19 forecasting. Results and discussions. So the first thing we did, we split our data into two parts, one for training and one for evaluation. The data before August 1st, 2020, we used it to train the deep learning model. The main reason we using the data before August 1st is that training the rise, most of the US state had the first wave of COVID-19 by August 1st, 2020. That's why training the model on the rise and unfold of the COVID-19 wave represent will help the model sufficiently learn to forecast both the incline and decline in the cases for the next 2 weeks. Then we use the data from August 1st until January 2020. January 22, 2021, of all the counties within in the United States for testing. We excluded some counties that has low population ratio. That's the resulted number of counties that's used for testing was 531 counties. And then we have a data over 161 days for testing. Our deep model was implemented and trained in Keras with TensorFlow as the backend. We used two metrics to evaluate the model. The first one is the mean absolute error, and then the second one was the percent correlation. So in this table, I'm showing that the training, validation, and testing results using the mobility data and without using the mobility data. We see that during training and validation, the mean absolute error was better for with the mobility data. However, during testing, it was slightly better, but not significantly better than without using the mobility data. But in both cases, the testing correlation was very high, was 0.83 with the mobility data, and the mean absolute error was 605 cases. In comparison, the testing correlation for the GTV was 0.67, which is significantly lower than the LSTM model. And the mean absolute error was higher, and it was 883 accumulated cases. So here I'm showing a few samples of our model predictions represented in green, and the blue is the actual number of cases. As I said, like this is for testing, started from August 1st. See, the model was able to predict the start of the outbreak here, and also here. And then the same thing was able to predict the decline. And this is just a few examples when the model with high correlation and a few samples with moderate correlation about 0.7. So we investigated we have a special model of the testing correlation for each county on the US map to see if the model is performing well across the US or like for a specific state. From this analysis, we see that the model across the US, the correlation was high. So like the blue is 1, and then going to the red is a -1 correlation. So we see only few counties when we have the low or moderate correlation to the actual COVID cases. However, on average, there is 87% of the counties had a testing correlation above 0.7. As shown here, you can see the majority of the counties, they have a correlation above 0.7. So the other thing is that we analyzed is the effect of number of cases in a county on the forecasting ability of the model. So and these figures we show that the accumulated number of cases during testing, the testing period that we use from August 1st, and then the number of counties in each bin, and also we find the mean absolute error versus and also the correlation for each of these bins. So we see with the increase in the number of cases, the correlation was almost the same. So it was almost like average 0.8, just excluding the counties with a few number of cases. The main absolute error was increasing with the increase of the number of cases, which is reasonable since like the model, like if there's, let's say for example here there's 30,000 cases, so the model missed by 1,000 less or above or below, then we have see like a high mean absolute error due to the increase in the number of cases. So the second thing we analyzed here is the model ability to demonstrate the effect of policy change. So the change in the lockdown policy, mask mandates, and other government responses directly will impact the daily COVID-19 cases. Hence, the model prediction of the two-week daily cases have to reflect that impact, as shown by the accumulated cases in the 2 weeks. So for that, to do the analysis, we utilized the government responses provided by Oxford COVID-19 Government Response Tracker. And from their data, we use the stringency index that represent that's between 0 when there's no restrictions and 100 stringent restrictions. So we and then we find out for each, let's say if there's 30% the stringency index was 30%, what was the change in the number of cases in the next in this month? So the next month due to the change of the policy. So to do that, we subtracted the number of cases in the last 2 weeks of the month after the change minus the first 2 weeks of that month that represent the change in the cases due to the previous policy change. So that's in this way we will be able to see what's the effect of the policy change for each county, and then we average that for all the counties. We see that when there's the stringency Israel was decreased to 30%, we have the worst case scenario when we have the largest increase in the number of cases within that month, which is about like 700 cases increase when there is a 30% stringency and there was declined to 30%. So, and the same thing here, we saw that the worst case was also estimated by the model. With the increase of the stringency or like the constraint or the lockdowns policies by the government, we see there is a decline in the change in the number of cases. And then we see like if there is 70% stringency index, then we will see decrease in the number of cases, right? And that's reflected also both by the model in the green and the blue with the actual cases. So from this, higher stringency index decreases the cases as predicted by our model and the actual cases. The worst case scenario, as I mentioned, it's when we have a 30% stringency level. So in this example here, we in this analysis here, we have we analyze the model ability to capture the effect of age demographics on COVID-19 cases. So we consider 3 demographics, young adults and retirees, when we did the analysis. So the way we did the analysis, we find out the counties with 10%, for example, 10% of their population are young, and then we find the average daily cases for these counties. right? For example, there's I think one or two so we don't, it's not clear here, but like about like 5 counties with 10% of their population are young, and we see that the number of cases are like about 40 for these counties. And then when the percentage of young people, like population, increases to 20%, we see there's an increase in the average daily cases, and so on. So we see that trend with the increase of young population. There is a trend of the average daily cases is increasing, and then for retirees, we see the other way around. With the increase of the percentage of retirees within a county, we see that the daily cases will reduce significantly. However, for adults percentage, we didn't see that that pattern either increase or decrease. For both the blue, which is the actual, and the green is the estimated, we see the same pattern both for all the figures that show the model ability to capture that effect of the age demographics on the model, on the prediction. So as a conclusion and future work, so the developed model was able to predict an increase and decrease and the total number of cases. And our analysis shows that our model has the potential to predict an outbreak in COVID-19 cases 2 weeks in advance. This knowledge about the disease spread now can be transferred to model future pandemics that share similar characteristics to COVID-19. One idea could be using recurrent conditional GAN to be used to model COVID-19, and this way we can simulate different scenarios for future pandemics. Okay, that's the end of my presentation. I would like to thank you for listening. Okay.